Hello. One of the biggest changes in female transgender hormone care over the last decade hasn't been a new estrogen or estradiol. It has been changing where we put the needle. Subcutaneous versus intramuscular estradiol injections can produce very different experiences for women. A lot of patients are never fully told why, and a lot of doctors don't even know why. This was a request I recently got in the comments, and as always, I try and get a quick turnaround on those subjects y'all request, and I appreciate your requests. I'm Dr. Dave, your transgender health and hormone specialist with nearly 30 years in the field. Let's go ahead and talk about that. First, the important part. Both methods work, they're great. Sub-Q and intramuscular injections, they both commonly use the same estradiol valerate or estradiol cypionate. Both bypass first-pass liver metabolism, meaning the estradiol goes directly into the bloodstream instead of being heavily processed through the gut and liver first, like oral estrogen is. That's one of the major advantages of injectable estradiol in general. Both routes can absolutely achieve excellent feminizing hormone levels. Neither one is experimental at this point, neither one is fake estrogen, and neither one is automatically superior for every person. But the way they feel can sometimes be very different for people. Intramuscular injection goes deep into the muscle tissue, usually the glute, shoulder, or thigh. The needle tends to be a bit longer, the injections are often a bit more uncomfortable, and the absorption tends to happen faster. That means the estradiol level often rises sharply after the injection and then gradually falls towards the next dose. Some patients feel completely fine on that pattern, no bother. Others notice it immediately, maybe some mood shifts, energy crashes, feeling emotionally off before injection day, even headaches or hot flashes near the end of the cycle. That isn't being dramatic, that's pharmacokinetics. Subcutaneous injections, on the other hand, are a bit different. Instead of muscle, the estradiol goes into the fatty tissue just beneath the skin, commonly done in the abdomen, thigh, or hip tissue. The needles are much smaller and shorter. Most patients find them dramatically easier and less intimidating. But clinically, the most important difference is this. The absorption is a bit slower and steadier for the sub-Q. Instead of a steep spike and drop, you often get a smoother hormone curve across the week. For many patients, that translates into more stable mood, more consistent energy, less of an emotional roller coaster, and often more comfortable long-term experience overall. Now, both methods have risks. Intramuscular injections can cause soreness, bleeding, bruising, post-injection pain, and rarely nerve or vascular injury if technique is poor. Sub-Q injections have their own issue. If you inject repeatedly into the exact same spot, you can develop lipohypertrophy, small fatty scar tissue lumps under the skin that can actually affect absorption over time. That's why site rotation matters, actually with both methods. One other thing people don't realize, sub-Q dosing is not always identical to IM dosing. Because the absorption profile changes, some patients need to dose adjust after switching, although usually less dramatically than the internet forums claim. So which route do I prefer clinically? I'm going to hedge here. I know it frustrates you, but what I always say is there's no best method, just the best method for you. For many patients, especially people self-injecting long-term, I think subcutaneous estradiol offers real quality of life advantages, at least with the feedback I get from people. Less pain, smaller needles, they say easier administration, and often more stable hormone levels. But as I said, there's no universal best. Your body composition matters, your dose matters, your metabolism matters, your labs matter, and most importantly, how you feel matters. This should be an informed discussion with your knowledgeable provider, not a comment section argument. Thank you for watching, and obviously, I appreciate all of your support. It truly leaves a warm and fuzzy feeling in my tum-tum. We'll talk soon, and it's always good to remember to love, support, and protect each other.